Hi everyone, it's me again, Mariana, psychologist, and I am part of Assure for Life. I am getting you the warm greetings of for this space that we are here creating this conference according to complete the process and also the cycle about the adulthood or also about the older age. We are glad to share this kind of topics with you because we have a lot of things that we would like to share and also give you the understanding about this stage of life. So, knowing this, um, and also remembering that we before talk about the mental health in the adults, and also we before talk about the physical health, we would like to talk now about the myths and facts about depressions in the elderly. This is a specific topic that we would like to share and also talk with you because it's important to realize the symptoms and also the signs, importance to also understand what kind of things are important to recognize and also try to look for the help and the intervention of a professional in case that we already have a diagnosis. Knowing this, we are glad also to have your comments and also suggestions or questions through our YouTube channel that we have open for you. Also, through this way, we can understand what kind of things you would like to also learn and know a little bit more through this conference that we have open for you. And also, we have this space created in order to give you other point of view about the psychology and also about the mental health in other ways to see it in also in all these stage of lives. Knowing this, I would like to introduce in the topic with an important sentence. Knowing how to grow old is the greatest of wisdoms and one of the most difficult chapters in the great art of living. Knowing this, I would like to share with you something important that we have to understand, and is understand how we will name this stage of life. We have to understand that we start to name or also say that this person is an old adult when have 65 years old or more. So when we have this age, you will have some changes in your life. We already talked about some changes, some psychological symptoms or psychological changes that you can have in this stage of life, and also some physical changes that you will have. And it's something important to understand that it's normal and natural to have this transition in your life, but it's something true that you can also have other challenges and changes in this stage of life. Sometimes the retirement, and sometimes you will have other status in your life, or you can leave other status in your life. Sometimes when you are a retired person, you can feel like that you are not enough, or even you don't have something important to do in the life. So that is something that you can start to question and understand that in this stage of life it's normal to question all that kind of things, and maybe you can start some kind of crisis starting this stage of life. Knowing all this and knowing all this transition, we can also start to reject some symptoms or even some changes of this stage of life. So we can also understand that and also accept that we are starting this stage of life as a new way or also a new chance to create and also have other opportunity to do all the things that you would like to do it in some kind of moment in your life, but in that moment you don't have the enough time or even you don't have the resource to complete it or do it, and now you have the chance to complete it. But this is a good way to see it, to see this stage of life. In other way to see this old age is the way that we can have some illness or even we can get sick, and that is natural, and also is something that we can have accept or even be close to some mental illness. And for that reason we have the depressions as the meaning illness that we bring to this conference. For that reason we're going to start talking about depression in the elderly person. It's important to talk about the depression, and it's not talk about the depression in general. It's talk about the depression in the old age, because it's the cycle that we are talking. And the depression in the old age is something that I already told you. Patients or people over 65 years of age, and will manifest itself as a simple mood of sadness, superficial pessimism, and may evidence deepest levels of melancholy. This will be few symptoms of the depressions in the adult or even in the old age, because we will have a lot of other symptoms that can prevalence in the time. So it's important to understand that the depressions always we have a lot of sufferment, and also we have a deep sadness emotion. So if you have some symptoms or similar symptoms that can prevalence in the time more than 3 weeks, is an alarm sign, and you have to look for help and also start to question what kind of things you have to do, and also you have to sometimes ask for help. Depression is in the elderly is different in this stage of life, and that is something that we have to talk a little bit profound a little bit more in the process of this conference, because it will be different in this stage of life. Knowing this, we have to understand that the depressions in this stage of life will depend of different factors, also psychological factors, physical factors, and also sometimes if you have a previous medical treatment will have some will give you or will give us some reasons to think about the depressions in this old age. Not always the depressions in this stage of life will have a connection with psychological symptoms. Sometimes it's about medications that you already have a treatment. With the time, these have some consequences in your life and also in your body. So you have to ask or look for the professional help, and sometimes they will give you also a different treatment and then we can have other way to see, and also have the intervention in this process, or also in this illness. Knowing this, I would like to introduce to the myths and facts about the depressions in the elderly, because we have a lot of beliefs about what is the depressions, and also how it feels, and also how we can see the depressions in this stage of life. One of the first myths is that depression is a normal part of aging, and that is not true. The fact is that depression is not natural, is not a natural consequences of aging. Is a medical condition that requires proper treatment. When you have a proper treatment about one different illness, it doesn't matter if it's a physical illness or if it's a psychological illness, you will have or you need a proper treatment. But it's not something that is it have a directly connection with the aging. You can aging is as a healthy way. You can have this idea about aging, maybe created because you see your grandparents, maybe they are suffering this stage of life, but it's not normal, the depression and also the deeper sadness in this stage of life. You can have this a mental illness maybe before of this stage of life, before to start to live in this stage of life. So you have to be clear with the things that you can or maybe the things that can be a consequence of have these symptoms that may be increased with the time. Understanding that the old age is not the final moment or the final stage. In the aging, you will have other way to see the life and other projects that you can create. It's not normal, the depression in the aging. Other of the myths is that depression in older people manifests in the same way as the younger people. And that is not true, because it's a different way and it's a different stage of life. You don't have the same energy, you don't have the same point of view, and also you don't have the same status. So the fact is that depression symptoms in the elderly can be different and are often overlooked or confused with other health problems. There will be treatment in a different way, with different medication, and also with different accompanion with professionals. When we are in this old stage of life, we will have a different treatment, and also we have different symptoms as depression in the younger people. One of the symptoms will be the persistent fatigue, with you feel with no energy all the time, every day. This will be a symptom that we can also take as an important and also as an alarm sign. Also, as I told you before, if these symptoms prevalence with the time more than 3 weeks, is something that we have to take the consequences and also take the care about these symptoms. Other is the loss of interest in activities they once enjoyed. If your grandpa, if your grandma, and also if you are now are living this old age, now you are not enjoying the things that you already enjoy to do it, is a symptom of depression. And also if this symptom prevalence with the time, something that you really enjoy with the time, like cooking, go to walking, or even pass time with your friends, with your family, and suddenly you don't enjoy it anymore, is symptom, is a depression symptom. So we have to be clear and also be careful of these symptoms and with the prevalence in the time. Changes in appetite or weight. If your weight increase or decrease, and also if you can feel the taste, or you don't enjoy the sauce of some food that you before enjoyed a lot, is a symptom or even a sign alarm. Sleep problems such as insomnia or oversleeping also will be symptoms. When I tell you about symptoms, is something that we can talk about also in a medical way. When we talk in a medical way, when we have fever, or when I have head, a pain head, or when we have a headache, is something that we can have as a symptom, and we already know how it feels, and we already know how to treat. But when we talk about psychological symptoms, we have to see the changes in the mood, or even the changes in something that we normally do. So if you change up your mood and suddenly, and you don't have even idea about what happened before, or even the reasons, and this changes prevalence with the time, you have to questions about it, and also take care about the symptoms. For that reason, we talk about symptoms for these changes in the mood, and also we change our habits that we already have, or even we have for many time before. Difficulties and in concentrating. If you have changes in your memory, and also for you it's complicated to complete a phrase, or even to complete a easy task, it's important to recognize when this start to happen, and even when will start to increase, or even if it's something that start to makes you feel frustrated. This will be other symptom. Feelings or wordlessness or guilt. This is an important symptom, because when you start this new stage of life, you can feel that you don't worthy enough, or even you feel guilt because you don't get the enough things, or you don't have the things that you dreamed before to have in this stage of your life. So if you start to have these thoughts, start to accept it and realize, and accept it as a psychological symptom, and also start to question about it. Thoughts of suicide or self-harm. This is important to take care about these thoughts, and also these feelings. If you are in this stage and is giving you this feeling of you are not enough, or the life will be ending right now, you have to accept and realize about these thoughts. And if you realize that your family, maybe your dad or your mom, or even your grandparents, are having these acts that self-harm, you have to take care of that. This will be an alarm sign. Knowing this, let's continue with the third myth. The third myth is depression comes when older people face loneliness or tragically lose of loved one. Not always the depression will be connected with some um, trauma or some difficult time or event. Sometimes it's something normal, hormonal, or sometimes it's changing in chemical um, um, substance that they have in the brain. As I told you before, sometimes we have a medical treatment for many years, and this will have some changes and consequences with the time. And also, we have a treatment, and with the time, if you can change the medical and also the medication, if you can change it. So, not always we as a family have to connect that depressions or that symptoms with some specific event that have this loneliness feeling or this tragical lose moment of lose someone that is important. Sometimes it's something more simple as a hormonal or chemical changes, and that is all. For that reason, it's important to look for a completed diagnosis with a doctor and also with psychology, and they will give you other point of view about if something have changed with the medical treatment with other illness that they have before. It's important to understand that not always have these depressions or even these depression symptoms burn um, as a consequence of a difficult event. And the fourth fact and myth and facts is there are no mental health problems in other adults. They just want attention. This is a myth when we would like to make the people or even to make that the person stop to talk about the illness or even talk about the pain that is suffering. We have to increase our empathy as a family and also as friends when they are talking all the time about what kind of things that they are feeling and they are passing through. If they talk or even have these moments or difficult moments, you have to understand if they are saying something that have deeply compressions that we can understand because have an illness through this process. So older people, the fact is the older people can suffer from mental health related illness just like people in other age groups. And understanding this will give you the chance to realize when we can start a treatment, an appropriate treatment to the people, and also stop the suffering, and also stop this moment of the people when they start to talk constantly about the pain they are suffering all the time. And the fact myth is that the elderly can't get better with treatment because they are too old. And this is a completely myth that we as a society completely created as a belief, because when we talk with the people that we already know, our grandparents, when we said, hey, we can go to the doctor, we can ask what is happening with your pain, with the deep sadness that you are feeling, If we can ask them what we can do, maybe this will be a better, or also we can have other treatment. And sometimes the other people stopped to ask the help, and they self say they don't have other chance or other opportunity, or they don't have other way to start the life. They are too old to start again the life, and they don't want to start the treatment. Sometimes it's our purpose and also our task to increase this self-care, and also accompany this process of the treatment, and also say it to them that they have if they have appropriate treatment, this pain will decrease, or also they can also have other way to see this illness, and maybe the diagnosis will be better and will give you the chance to less the pain and also less the suffering of the other people. The fact is, the older people are just as capable of responding to mental health treatment as anyone else. They have the enough abilities and also the enough strength to complete the treatment in this stage of life. The science have developed many ways or many other ways to give us the chance to increase the stage of life and also increase our lives. So if we can complete the process in a good way, many times we can also have a health older person in our lives, and also in our social near media, and also understand that they have the chance also again to create other way to see the life. Is a new chance to create, and also way to change, and take the opportunity to see how they can increase the time that they have, accept the stage of this life, and also accept the natural decrease of the mental and physical symptoms. Sometimes the pain of the body will be increasing with the time, but also try to move the activities that they already have. This will help with the way that they can see this new stage of life. Our last myths and facts will be that the older people with mental health problems are violent. The fact is that being aggressive or unimperative is not a characteristic that defines mental health problems in the older person or in the older people. Be violent or aggressive in this stage of life will be a symptom or something else. If you have your grandpa or your grandma have some violence or aggressive and habits, sometimes she or he is having this mood, you have the chance to look for the social or also the ambient, because maybe something or some factors, social factors, have an directly impact in the adulthood or even in the older and mood, and also that is the reason why they are maybe aggressive and violent. Many times when a person have a mental illness, and they will be treatment by medical and also for medication, they will not be aggressive or violent. For that reason, it's important to understand if maybe the the ambient is hostile, why they will have this reaction, and also try to be empathic with them and understand what is happening, and try to understand the reality of getting older. If you have a previous illness, and that will be frustrating when you're getting older, maybe the people can understand you, maybe you can also having this chance to talk about your feelings and how frustrated will be the life now, and that will be sometimes the consequences or deeply feeling of frustrated. So try to understand why can they be sometimes aggressive or violent, but it's not normal, it's not natural. And also, as I told you, when you have previous diagnostics, and you have a proper treatment, most of the patients then have these aggressive move or reactions. Knowing this, we will resume the risk factors. The risk factors is important to understand it and look at if you have some of them in a closer people, or even if in a closer old person that you already know. The first is the loneliness and social isolation. We are social people, we need each other. When an older person uh, start to isolation, and start to the decision of start to feel lonely, or even you try to call them and they say they prefer to staying home alone, you have to question about this kind of movement, and also why they are having this decision. Because the isolation in this specific stage of life will be one of the risks that we have to confront. It's important because when the older start to feel lonely, they can have also these other talks about insufficiency, and also they can talk that they don't have other chance, and also they feel the is the enough time, this is the end. As an important date, and the OMAS have an study about the elderly, and it's important to understand that the biggest percentage of suicides is in the people of 85 years old. So it's a risk factor, the loneliness in this stage of life. So if you realize that your dad or your mom or even your grandpas having this decision of better getting lonely, or start to this social isolation, start to question about it and try to bring into the family activities, or even try to give some other tasks that they can have, or even develop with you as a family, and also be close with you. The second risk factor is the chronic health problems. If you already have for many years physical illness or a mental illness, this is a risk factor because the people start to feel tired, and they don't have this hopeless that before have. If you have a previous chronic problems, this will increase the depression because it's enough, and they think that this is enough with previous illness of many years, maybe 10 years, having the same illness, having the same treatment, most of the people will feel tired, and also they feel that this will be enough, and also maybe is better the death, and also is better the final. So try to see and understand that is a difficult time. If you have previous chronic problems, is probably that you have these depression symptoms because maybe you feel tired. For that reason, we always give you this advice of feel comfortable and get this strength with the family and also with the professional that can help you in this process. The third factor is the grief. When you can complete a grief, it's not always a grief when you lose a loved one. The grief will be when you lose something meaningful. I mean, a status, a divorce, even when you lose your job, when you start to be a retired person, this is also a grief. When you lose something important, when you can complete this grief appropriately, this will be some risk factor. It's normal to have this grief in our lives. It's natural, it's part of our life. But it's not normal to have an unhealthy grief process. When you can even talk about it, when you can even feel the pain or even talk about it or accept the change and the challenges of this stage of life. And the fourth change risk factors is the changes in independence. This is normal in this stage of life. As a difference, when we are childs or when we are kids, we need people to complete our normal activities or the normal things that we already know to do it. Sometimes we can complete the activities that we before can do it. In this stage of life, we start to need the people again. And sometimes there's enough thought or insufficient thought will appear. It's something important to try to look for the help and be open to look for the help when you need it. And also accept that we have this stage of life or give and work for this society. In this stage of life, we can also accept and receive all the things that we already give. So this is the moment in this stage of life, older stage of life, accept all the things that we already give and did for this society. Knowing all these risk factors, now we have the things that we can do and also all the benefits that we can have in this moment, in this stage of life. So we can understand that the key actions for help in this process will give us the chance to stop or prevent the depression. One of the most important is education and raise awareness. Because if we know the symptoms, if we know how increase, the depression will be something that we can understand and see before the time. And also we can stop it when the depression starts to give us the first symptoms. So it's important now that we have the chance to understand and know the symptoms, understand how it looks, and also that we can have the accompany of the medical and psychological professionals. So educate and realize all the things that we can have in account about the depression and all the generalities and symptoms about it. The second is encourage open communication. It's important to understand that is twice a job as a family, friends, and also as older adults. If I understand that I have some symptoms, the prevalence with the time, I have to be open with the communications and ask for the help. And also, if I have somebody that I know that maybe have these symptoms, look for that people, look for that person, and talk about the depression openly without fear. Because if we normally talk about fever, it's because we know that they have a normal and proper treatment. It's the same with the depression. If we can talk about it, we will know that they have the same proper treatment in the previous time. In the previous time, in the exactly time, the depression will be well treatment. The third key that we have is the access to medical care. It's important to have this access to the medical care when we have some talks about, as I told you before, the risks. If you have more of one of two of these symptoms in the prevalence with the time, you have the responsibility of look for the medical help. And even if you know an older person that have all the symptoms, the prevalence with the time, look for the medical help, ask for a diagnosis, and also for a proper treatment. And this will help you, and also this will be the prevention of the depression in a proper way. If we can stop and also we can treatment in the previous or in the exactly moment, this will help us with the process in a very, very good way. The fourth key is emotional support. The emotional support is pretty important in this stage of life. Understand that we can be open with our emotions, with our support family, with our support social media. This is important in this stage of life. If we can talk with a friend and they can give us the chance to express how we feel about this stage of life, and also they can share with us the same feeling, this will give us a sense of don't feel alone, don't feel that I am going crazy, or maybe this is happening only to me, I don't know how to confront. If you have this person that will give you the chance to open all the feelings that you are living or you are going through, and this will give you the motivation to talk a little bit more and also understand how it looks the depressions, and also how they will be the correctly treatment. And the fifth key action will be reduction of social isolation. Stop with that, and also be close to the people that you feel comfortable and you feel safe. If you have this open and deep connection with your family, it doesn't matter if you only go to 1 or 2 hours every day. If you don't live with your family, it's important to do it every day, or even constantly, because this will increase the importance, um, this sense of feel important, or even that your life is important in the society and also in your family. This will give you the chance, or even the sense, that you are part of something, and also feel part of something will give you the sense, or even the connection with the life, the sense of life. Knowing all these key actions, I would like to finish with this beautiful phrase. Says, and if fire is what burns in the eyes of the younger, light is what we see in the eyes of the elder. Light is what we can see in the elderly when we have a beautiful younger life. It's not the end of your life, it's not the end of your time. It's a new chance to create projects, it's a new chance to complete something that you would like to do many times before, and sometimes you don't have time. This is a new change of life, this is a new cycle. Understand this with the enough energy, understand this with the enough support of your family, will be the key to in from this stage, and also in from all the consequences and the love that maybe will have. For that reason, I would like to give you the chance to understand that you have the opportunity to ask for professional help through our channels. Will be WhatsApp or even email. If you are a Sure for Life member, you have this benefit without additional charge. And if you are seeing us through our YouTube channel, remember that we already have other conference about the other adults, and also about the grief and quality of life in our YouTube channel. This is our important invitation today. If you would like to have this professional help, you have this benefit if you are a member of Assure for Life. You have all the contacts in our channels in this conference. I am so glad to share with you all this information. Remember you that also we have this space in order to give you one moment, and also other certain moment to be close to different topics in the life that sometimes we can talk about it every day with all the people. For that reason, we create this space. We are Assure for Life, and we stand by your side. Thank you so much.